All of us know someone suffering from the pain of arthritis, but there's more about this disease you might not know. So let's see what we can learn talking to an arthritis researcher and someone you may have seen in his PBS specials or maybe a TED Talk. Maybe you've read one of his many books. It's author and physiatrist Dr. Vijay Vad from the Hospital for Specialized Surgeries in New York. So glad you joined us today.
Thank you, Lee. Thanks for having me on the program.
Yeah, you bet. I saw you say something in another interview. I want to start with that. You advised other physicians don't get married to prescription pad for arthritis patients. What do you mean by that?
So, like when Eisenhower left office, he said, beware of the military-industrial complex. I think there's also been this pharmaceutical physician complex, and you have to always think outside the box and not be boxed in by the powerful pharmaceutical forces around us. So, and by that I mean, I unfortunately paid a big personal price because my grandmother died from reckless anti-inflammatory prescriptions given by her physician when I was 16 years old from a bleeding ulcer. So I learned firsthand, don't be married to the prescription pad and take it out every chance you get, because the reality is every time we write an anti-inflammatory prescription in spurts, it's okay. Every once in a while, it's okay. But long term, given months in, months out, years in, years out, we're causing more harm than good. And those anti-inflammatories can cause increased risk of high blood pressure, heart disease, peptic ulcer disease, kidney damage, and death from bleeding ulcers.
What are some of the drugs that we're talking about there? Can you just call them out by name so patients might recognize them?
So the drugs we know, Celebrex, Advil, Aleve. Those are the ones that come to my mind. Even if they're over the counter, they can do the same thing with increased risk of heart disease and blood pressure and what have you.
Yeah, so many patients just depend on those drugs to get through the day. If I'm not using those, what alternatives do I have?
So not only Advil, Aleve, and anti-inflammatories can cause kidney damage and high blood pressure, even Tylenol. We really lowered down the numbers for Tylenol because it can cause liver toxicity. So I think what I call integrative options, which is omega-3 fatty acids, a diet rich in omega-3 fatty acids, or just taking omega-3 fatty acids, whether it's from flaxseed oil or fish oil, curcumin, which is from turmeric. Those are all integrative natural options that are in the first do no harm. And last but not the least, if you combine with a good diet, it can have a synergistic profound impact on reducing pain and arthritis and enhancing mobility. I always tell Cornell medical students who rotate with me every week, don't treat the MRI or X-ray, treat the patients, and structure doesn't correlate function. So you can have bone-on-bone arthritis and still minimize a lot of that pain. Of course, it's multifactorial. If you're very obese and have bone-on-bone arthritis, then all those strategies may not succeed. But if you keep your weight down and incorporate some of these integrative strategies, despite bone-on-bone, you could lead a pretty active life.
Well, you just hit on an important topic there. We're all struggling to get our weight under control, so much more difficult as we age. I know you're big on the issue of insulin resistance. Can you help people understand that concept? And then we'll talk about what you can do regarding that.
Yeah, so, when we talk about weight, so it's 4-to-1. So for every 1 pound, you put 4 pounds per square inch on a hip or a knee. But that also means for every 1 pound you lose, you're decreasing 4 pounds per square inch on the knee and the hip, the physics of it. So basically, the whole diet where, first of all, the whole 3 meals a day and eat breakfast like a king, I think those were valid points when we were farmers. But unless you're working 8 or 10 hours of manual labor a day, one of the worst things you can do is start the day out with a heavy breakfast. Because what that will do is it will release a ton of insulin into your bloodstream for the rest of the day. So whatever you put into your mouth the rest of the day, it will want to get absorbed by the body, causing weight gain. So the less the insulin levels, the less the weight gain. So if For example, if you are on a 2,000 calorie diet a day, and I am also, but I eat the wrong food and eat too much of it early in the morning, I may gain weight, and you, with a wise diet of 2,000 calories, where you decrease insulin resistance, you may keep your weight the same or even lose weight.
Oh, so let's walk down the road of eat this, not that. Uh, so I know you're going to tell me stay away from processed foods. So explain to me what is a processed food? How do I spot that in the supermarket?
I mean, in general, the rawer the food, the less processed the food in general, the better it is for your body, right? So, for example, if I drink coffee in the morning, that's half milk, or let's say half and half, with 2 spoons of sugar, and then I eat one donut, and that's my breakfast, versus Lee, who drinks black coffee and has a bowl full of blueberries. Let's say even calorie wise, both are same. But in my case, my insulin levels will jack up and remain there for the rest of the day. In your case, insulin levels will remain low, and thus the any food you eat afterwards during the day, it won't just come right into your tissue and add body weight.
Oh, I get it. That makes a lot of sense. So closer to the earth, closer to nature, closer to a whole food, the better off I'm going to be.
As a general rule, yes. Having said that, I think there are exceptions to every rule. So even though cow's milk is not processed, it's, if you could call it, natural. I mean, milk is one of the worst causes of insulin resistance. I mean, it is a sugar load on your body. The milk, for example, we give hypoglycemic patients either orange juice or even worse, better is milk. It jacks up your blood sugar, skyrockets, and then out comes insulin to try to normalize that blood sugar. So yes, for the most part, what I call different berries, green vegetables, lentils, and if you're going to do sort of carbs, maybe more from things like black rice. I don't know if you've heard of any of these terms. Quinoa is a hot topic, but that's much better than white processed rice or just full grain.
Yeah, we talked before on the program about the Mediterranean diet, and the whole concept of eating like a Mediterranean peasant is one of the healthiest ways that you can live. Tell me what you see in patients who have a real success story. How do I model them and get over the hump with this arthritis challenge?
Well, I mean, probably the biggest success story I can tell you is I had a patient who was determined to not get his knee replaced. And he was maybe 20, 25 pounds overweight. Loved his steak, loved his ice cream. And he's kind of the textbook example of integrative options that really work. And he was popping Advils, overweight, bad diet. And ironically, he also developed premature coronary artery disease at the age of 54. So when he got that news in the knee, he said, look, I'm going to become a vegan. Now, that's just the extreme end of radical diet changes. And again, by vegan, I mean he was taking in complex grains. He was taking in oatmeal and quinoa and black rice as opposed to processed pasta or white bread. Lots of berries and green vegetables, and a lot of olive oil, which is very rich in something called oleocanthal, which has natural anti-inflammatory properties. Um, and he was also pretty vitamin D deficient. So he also started taking high levels of curcumin and vitamin D to normalize his vitamin D, because that's important to keep the bone strong in our arthritic joint. And, the deal I made with him is once a month, you could eat a steak once a month. It's not you got to live life a little bit, you know. and once a month you can have your ice cream. And in 6 months he lost his weight. He was walking 4 to 5 miles a day. The knee wasn't bothering him at all. And his cardiologist called me and said, "You did a fantastic job." And then I said to the cardiologist, "No, you did a fantastic job because you scared him that he's going to die of a heart attack." So that's one of those great stories where the person took the power in his own hand and made things happen.
Yeah, that's a great story indeed. So, you pay a lot of attention to what's going on in arthritis research. Look out into the future and tell me what kind of a breakthrough do you see coming? Is there something on the horizon that's really exciting?
Well, hopefully that's one of the technologies I'm developing that's going through the FDA right now, and the clinical trials will soon be published. But it's a procedure called carboplasty. It's a 15-minute outpatient procedure where we take stem cells from your own bone marrow and we inject them where the bone and the cartilage meet. And so far in arthritic knee, the results have been very, very promising. And it has a potential, a simple 15-minute procedure of getting rid of dependence on partial and total knee replacement. So we'll see how that plays out.
Oh, your audio broke up a little bit there, so I want to go back and revisit that. So you're harvesting bone marrow and expressing the stem cells from that?
Yeah, we're not even harvesting it. It's just point of service. We're taking the bone marrow out and we're injecting it where the bone and the cartilage meet. It's a 15-minute procedure from start to finish.
Wow.
Outpatient, no downtime, no hospitalization. We've done over 1,000 of these carboplasty cases in 5 countries so far. No blood clots, no infections, and no deaths. And we're going right now through the FDA process here to get it commercialized. But it has a potential to markedly decrease dependence on partial and total knees. It's in the spirit of what I've been developing. It's cheap, it's effective, little to no downtime, and so far, no real morbidities or mortalities.
So how is that different than the restorative rejuvenative therapies using stem cells? You're just taking the bone marrow and not processing it, just extracting it and injecting it into sites?
Yeah, but the key is we're not injecting it just into the joint. We're injecting it where I think the crime happens. That leads to loss of cartilage. We're injecting it at what we call the bone cartilage interface. That's where the bone is feeding nutrition to the cartilage. And when alterations occur in that bone cartilage interface, that leads to lack of nutrition to the cartilage is when we start seeing development of arthritis. I mean, it's based on that hypothesis. And so far, the results have been absolutely spectacular in a 2-arm clinical trial that we hope will be published in the fall. And we hope sometime in 2023, fall or 2024, this technology will be commercialized.
That is very interesting. So you're causing the cartilage to regrow in that joint?
Well, we have been able to regrow the cartilage in the younger people, not in the older people, using your own bone marrow. But the pain relief is pretty powerful, whether you are able to grow the cartilage or not. And it's really all about the pain relief, really, at the end of the day. And hopefully down the road, we'll bring in better cells to play that may really grow the cartilage. So I'm very excited about what the future holds. Are these minimally invasive biologic therapies that could reduce dependence on expensive joint replacements and get rid of the morbidity like infections, blood clots, and obviously there's mortality associated with joint replacements. You could die from blood clots.
Yeah, sure. I get it. That would be a huge step forward. Hey, before I let you go, I always like to ask guys like you who are out there on the leading edge of things, how do you live differently than maybe me or the rest of us? You've seen so much, you know so much. What's different in your life?
Well, so I'm blessed with having incredibly smart patients from all over the world. And believe it or not, I just keep my ears open. And I should be paying them, but they educate me every day about life, science, love, politics, you name it. And so it's a true blessing to be in clinical practice where you get access to the whole world. So maybe maybe I'm privileged, that's different. But other than that, I mean, I put my pants on one leg at a time like everybody else. I think the runs in Central Park on Fridays that I do have helped me create things. That's my creative time. But other than that, I think a lot of luck.
Any supplements that you take on a regular basis? Dietary
I
changes?
take I take curcumin and vitamin D3 every single day. Um, I mean, I take a little bit of resveratrol because it's supposed to prevent telomere shortening, which is another whole anti-aging topic. But I think to me, whether it's insulin resistance or reducing telomere shortening or reducing risk of degeneration of the brain, is I do anywhere between 20 to 30 minutes on a Stairmaster every single morning. And to me, that's the best medication for me personally. And I think 20 to 30 minutes of aerobic exercise daily is probably the best medication we can dispense.
I think that's a good place to leave it. I am so glad we connected. Thank you. It's Dr. Vijay Vad. I'm really glad we connected to learn a little bit more about arthritis and what you think is the right way to fight this disease. Again, thanks.
Thank you, Lee. Thanks for having me. Enjoyed it.